Nearly 12.8 million children have tested positive for COVID-19 since the onset of the pandemic, that according to the American Academy of Pediatrics. What does that mean for these kids moving forward? Pediatrician Dr. Cyrus joins us to talk more about lasting COVID effects in kids and the warning signs that parents need to know about. Good morning, Dr. Cyrus. Thanks for being here.
Good morning. Thank you for having me.
We've heard about long haul, long term. What constitutes that when it comes to kids?
You know, when you talk about the long haul and that long-term situation, it's out at least 30 days. That's the kind of the guideline that we get from the AAP. A lot of times the symptoms of COVID go away and then return these long-term effects return out around 30 days. So sometimes that gap is difficult to remember that, oh yes, I've had COVID and now I'm maybe having some long-term effects.
Yeah, because parents may have dealt with the acute onset, but now we're 30 days later. Talk to us a little bit about maybe mild symptoms versus severe symptoms.
You know, the mild symptoms is what we're seeing probably most, which is good to one degree, but still does affect our children. And what that is, one of the big ones is what we refer to as that brain fog. Kids are just saying it's hard to concentrate. Of course, you know, now they're back in school and they're trying to continue with their grades and such. And so it's difficult there. Obviously, tiredness, fatigue, those things that, you know, they may be good in the morning, but in the afternoon, you may find them falling asleep at school. And then headache and cough. Cough has been compared to like a 100-day cough. We call it a 100-day cough because it's very similar to pertussis or whooping cough. Though they obviously don't have that, it's still at length of time, and so it sometimes can cause some chest pain and things along that line. The more severe symptoms are this multi-system inflammatory syndrome that we see in children that can affect you know, the arteries and the veins, and they can affect the GI system, the skin. Those need medical interventions, you know, so needs to be recognized fairly quickly. Obviously, fever, muscle pain, joint pain, things along those lines. And then this, when we think about the chronicity of disease, of almost any disease, there can be some anxiety and depression that goes along with that. And then, of course, sleep problems because of just being uncomfortable during the night.
Sure. You know, I know some kids may have lost a loved one in their life due to COVID, whether that be an immediate person like a parent or a grandparent, or even just an adult in their life. What can be done to help them, and what kinds of some of the problems they may be experiencing if they're kind of worried about that?
You know, COVID has affected the adult population dramatically. It has affected somewhat the child population, but it's very low. And so when we think about how that it affects our children psychologically, not just physically, but psychologically, when they lose a parent or a grandparent or guardian, it obviously can cause depression. It can cause poor educational outcome. I mean, when you're stressed and you're thinking about the loss of a loved one, or even actually both parents, and they become an orphan and have to go live in another city or another town, go away from their friends, those are all a huge trauma to the child psychologically. And they may go to a kind of a dark spot, and we need to be able to recognize that and you know, treat that.
Let's talk about treatment. What's available for the kids that are having these long-lasting effects?
You know, one of the big things is especially with the brain fog, there's some work in neuroplasticity when we've used in stroke patients and brain tumor patients in the past, and using those exercises over and over again has been showing some improvement to clear that brain fog and to get the concentration back for the population, not only in adults, but obviously in children too. Counseling, getting them in to talk about their fear of maybe not them dying, but maybe a loved one dying, the fear of failure, things along those lines when it's been affected by their concentration and their grades are dropping and they're used to good grades, then you get in with a counselor or psychiatrist, psychologist, and be able to treat that anxiety, depression. The key here is recognizing it early, and this is one of the messages I wanted to get out to the public, is to be able to recognize it early. Don't just dismiss it and say, oh, you'll be fine. Get in there, get an early intervention. It's going to be a better outcome when we work with them earlier.
All right, Dr. Scott Cyrus, as always, we appreciate your time. We'll see you again next month.
Thank you very much for having me.